Hi, I'm Dr. Water. I'm a doctor, the kind who keeps working adults healthy, occupational, and preventive medicine. Ever watched a hero fight on, spraying blood, and gone quietly straight-faced? Wait, if you actually lost that much blood, could you still stand? Chainsaw Man is a series that is relentless about the volume of blood. Arms fly, bodies tear open, and the leads keep moving. So today, not as a review of the series, but as a story about your body, I'll check the math against the physiology of bleeding. The short version up front: whether you can move is decided less by how many milliliters you lost than by what fraction of the whole you lost and how fast. And the human body is tougher than you'd think and slips into the danger zone more quietly than you'd think. I'm not here to judge the series. I'm here to ask, if a human body did this, what would really happen? And back every medical claim with a paper or a standard emergency medicine textbook. And I won't play up the spectacle of blood. I'll only look at what's quietly happening inside the body. Bleeding this much and still standing to fight. That toughness is half real. In the series, characters take what look like fatal wounds and then, right after, talk, run, and counterattack. Every time, I think, is there any blood left in there? Start with the baseline number. A healthy adult's total circulating blood volume is about 7 to 8% of body weight. For a 70 kilograms person, the blood circulating inside them is roughly 5 liters, 5 cartons of milk. So the way emergency medicine measures danger isn't the absolute, how many ml came out, but what fraction of that 5 liters you've lost. And severity is graded in 4 classes by fraction lost, the standard trauma classification, ADLS. Mild, up to 15%/750 ml heart rate ticks up a little. Young and healthy, you look about normal. Moderate, 15 to 30%/750. 1500 ml heart rate rises. The periphery clamps down, hands and feet go cold, the pulse weakens. Severe, only now does blood pressure start to fall and consciousness begin to cloud. Critical, directly life-threatening. So bleed dramatically and still move normally for a while is, in itself, physiologically possible, but only while the body is covering for you with everything it's got. That on-screen toughness isn't a total lie. It's just, as we'll see, not something to be glad about. Takeaway: the yardstick for danger isn't how many ml came out. It's what fraction of your whole 5 liters you lost and how fast. Faced with bleeding, it's more useful to think in fraction and speed than in spectacle. Why do they look fine after heavy bleeding? The body is frantically hiding it. Here's where the body is magnificent and, at the same time, most frightening. Once bleeding starts, the body flips into emergency mode. The heart beats faster to cover the missing blood with sheer RPM, the peripheral vessels clamp shut, and blood is routed preferentially to the organs you can't afford to drop, brain and heart. While this compensation is running, blood pressure can hold and symptoms can stay sparse. The problem is that compensation has a ceiling. By the time the obvious abnormalities, falling blood pressure, altered consciousness, clearly appear, you may already have lost more than 30% of the total. In other words, looks fine is not evidence that danger is far off. It's the stretch where the body is quietly running up debt. One more trap. In older people or those on beta blockers, heart rate/blood pressure medication, the speed up the heart to cover it, response itself is blunted, and the textbook vital sign changes may not show. Some people are more dangerous the calmer they look. Takeaway: a person with a big injury being up and moving doesn't mean they're okay. Pale face, cold sweat, fast pulse, off responses. If those show, treat it as a sign compensation is near its limit, even if they say they're fine. Don't judge it yourself. Call emergency services without hesitation. Blood doesn't stop because you gut it out. Straight-faced here. Swept up in the series' intensity, it's tempting to read it as holding on through sheer willpower. But what actually happens in severe bleeding is the opposite of willpower. The body's own clotting system breaks down. I'll write this part without wit. In serious trauma, heavy bleeding brings on 3 things at once: impaired clotting, coagulopathy, the body turning acidic, acidosis, and falling temperature, hypothermia, which worsen each other. Emergency medicine calls it the lethal triad, and once you enter that vicious cycle, the variability of a wound to clot and stop itself falls. So the more bleeding progresses, the harder it becomes to stop. It does not, on its own, tend toward recovery. Which is exactly why, In real life, wait and see with heavy bleeding is dangerous as an amateur call. And this article is not a first aid manual. Wound compression and tourniquets have correct techniques and indications, and doing them your own way can make things worse. If strong bleeding happens in front of you, the first thing to do is one thing. Call emergency services and follow their instructions. That is the surest first step toward hemostasis an untrained person can take. Takeaway: a scene of heavy bleeding is not a place to show off your hemostasis skills. The first thing you should do before reaching for a self-taught technique is call emergency services and get instructions. This part, straight-faced. For the record, I'll confess, I used to be the guy who, from too much TV drama, believed the tighter you tie a tourniquet, the better. In training, I got the correct indications and dangers drilled into me and apologized profusely. Updating your knowledge matters. Is make it in time and you live true? The line where medicine can claw it back. So is heavy blood loss simply the end? Here, real medicine is a little more hopeful than the manga. Modern emergency and trauma care is moving toward put back the blood that was lost, in the amount lost, in the right balance, fast. Concretely, a race against time. For traumatic bleeding, giving tranexamic acid, TXA, a drug that helps clotting, early, especially within 3 hours of injury, significantly lowers all-cause and bleeding deaths, as shown in a large clinical trial. Conversely, the later it's given, the weaker the effect. What divides survival is often not guts, but minutes. The balance of putting it back. In severe trauma with massive bleeding, rather than pouring in red cells alone, giving plasma, platelets, and red cells in a balanced 1:1:1 way early, damage control resuscitation, reduces early bleeding deaths. Holcomb et al., PROPPR. JAMA, 2015. Blood isn't made only of the red part. When to transfuse is managed too. Meanwhile, in many patients who've stabilized after bleeding stops, a restrictive strategy targeting hemoglobin around 7 to 8 g/dl doesn't worsen outcomes. Transfusion is not more is better, but a managed act of when and how much, with the caveat that evidence is limited in some high-risk groups, such as traumatic brain injury. So what saves people in reality isn't shouting or fighting spirit. It's the plain trio of time, balance, and management. Characters look immortal by the magic of story. Real clawing it back is quiet, procedural, and genuinely keeps people alive. Takeaway: in massive bleeding, what divides life and death is often how fast you got them to medical care. So the best you can do in real life isn't to keep grinding your own way. It's to hand that precious time to medicine as fast as possible. The chance to claw it back lives inside the speed of your phone call. A body that bleeds and fights on and heals by itself, like a Chainsaw Man character, doesn't exist in reality. The body's toughness is time while compensation covers for you, not infinite stamina. And in heavy bleeding, the body's own clotting system breaks down. But real medicine has a different hope. Not how much blood you have, but how fast and correctly you can put it back. What keeps people alive in massive bleeding isn't guts. It's minutes, a plain balance, and careful management. So the strongest move you can make in real life isn't self-taught hemostasis or willpower. It's calling emergency services fast and handing that time to medicine. Manga is a doorway into how strange the human body is. And the real body is far tougher and far more delicate than you'd guess. See you at the next checkup. Thanks for watching. I'm Dr. Water. Subscribe for the next body check, and I'll see you at the next appointment.